Hi, I'm Ed Ryan. In over 21 years of work with the U.S. Olympic Committee, I've treated just about every athletic injury there is. I've used all sorts of modalities and treatment strategies. Athletic trainers like me are constantly seeking ways to accelerate healing of an injured athlete, to reduce pain, swelling, and inflammation. About 6 years ago, I came across the Polymem family of products. Polymem was created by Bob Sessions, who invented the first implantable pacemaker and red dot electrode, among other innovations. Polymem is made in the USA, in Ferris's facility near Chicago, and is used worldwide in every setting from hospitals to athletic training rooms. Polymem's patented formulation helps to inhibit and localize the body's natural inflammatory process. This is thought to occur through the absorption of sodium ions from the outer epidermis. Polymem can help reduce inflammation and relieve pain in the process. Polymem comes in two versions, sterile and non-sterile. The pink dressing is a sterile dressing that's used for open and closed soft tissue injuries. It's also available as an adhesive dressing in many shapes and sizes for localized treatments. The non-sterile version is green. It is available in wraps and rolls that can either be cut to size or wrapped circumferentially around a joint. Lastly, we have a sterile product, Polymem Silver, as an antimicrobial dressing for wounds that are infected or may be prone to infection. Today, I'm going to show you how I use Polymem on some of the most common sports injuries. In using sports wrap for an ankle sprain, it may be used for inversion ankle sprains damaging the lateral tissues, or eversion sprains affecting the medial tissues, or high ankle sprains damaging the syndesmosis. So when managing an ankle sprain, we would use the sports wrap with the elastic wrap attached to it. The 4-inch sports wrap is the wrap best applied for the ankle. So in managing this lateral ankle sprain, we would start the sports wrap on the lateral aspect of the ankle, covering up the entire ankle, and then following up by holding it in place with the elastic wrap. You can use the sports wrap roll to cut smaller pieces out or to cut specific shapes. So by using the sports wrap roll, you can cut a horseshoe out in order to fill the natural sulcus that exists on the anterior and posterior aspect of the ankle around the medial and lateral malleoli. Here we've cut a horseshoe out in order to fill the sulcus between the anterior aspect and the posterior aspect of the malleoli. So going around the malleoli, apply the horseshoe in place. Always get your athlete to participate, hold it in place, and then cover the entire ankle now with a sports wrap over the horseshoe. And use the elastic wrap to keep the material in place. In managing plantar fasciitis, you'd select a sports wrap that's appropriate for the size of the athlete's ankle, where the objective is to cover the calcaneus and the insertion of the plantar fascia on the calcaneus with the sports wrap. I find it especially effective to have the athlete sleep in this dressing and we'll give them the dressing, instruct them on how to use it, and then a Ziploc bag for them to put the dressing in once they awake in the morning. So we just want to cover up the plantar fascia insertion on the calcaneus and then hold it in place with the elastic wrap. Polymem and sports wrap are effective in managing the pain, swelling, and inflammation that accompanies Achilles tendonitis. You need to cover the affected area of the Achilles tendon, typically from its insertion on the calcaneus approximately a number of centimeters, as that is commonly the most affected area. In order to ensure that you cover the Achilles tendon, begin over the painful area and then wrap up and around using the elastic wrap to hold the sports wrap in place over the Achilles tendon. Imagine that this athlete has a blister on the posterior aspect of her heel. After you clean the wound, clean the blister, clean the surrounding area, and the skin is dry, then we can apply a Polymem dressing directly over the blister and secure it in place. It has a very effective wound covering and dressing to treat the blister. Polymem is available with various shapes and sizes and with different adhesive properties. This one being a cloth-backed adhesive, very effective for blisters such as one on the posterior aspect of the ankle. The 5-inch sports wrap is very useful for managing problems of the knee, as it's appropriate size and it has the elastic wrap. Start distal to the knee joint, move proximal, and then secure it with the elastic wrap. You can use the sports wrap roll in conjunction with an elastic wrap. Again, I'm starting distal to the knee, keeping the sports wrap in good contact with the skin, and then just covering it up with an elastic wrap. So in the event of a contusion, such as to the quadriceps, you can use sports wrap by simply cutting a piece out of a sports roll and then holding it in place with an elastic bandage. So you'd want to cut a piece that covers the area of the contusion while overlapping onto good skin, good tissue. I've always been taught to round the edges, so we'll round the edges of this dressing. Additionally, you can always hold the sports wrap onto the thigh, whether it be anterior for the quadriceps or posterior for the hamstrings, with compression shorts. If you'll hold that in place. And we'll just use an elastic wrap. Again, following normal practice of applying the elastic wrap distal to proximal in a nice herringbone overlapping pattern. So sometimes you can use the compression shorts that the athlete has on in order to hold the sports wrap dressing in place. So a high thigh contusion can simply be held in place by compression shorts, and then actually the athlete can either wear that around or can actually train with this. For a hamstring strain, apply a cut piece of sports wrap over the affected area. Ask your athlete to hold it in place, and then use an elastic wrap to secure it in place and to provide just a little bit of compression to that acute hamstring strain. Hold that for a second. So imagine this athlete has an abrasion on the lateral aspect of their thigh. Following cleaning the wound, you'd select the appropriate dressing that would overlap the wound at least by 1/4 inch to up to 2 inches in order to provide adequate coverage. You'd also want to make sure that the area surrounding the wound or the abrasion is clean and dry so that the adhesive will stick to their skin. Peel off the protective backing, applying the dressing to the abrasion, and then apply it in place. So again, you would select the dressing based upon the size of the abrasion. After cleaning the wound, you want an overlap of the Polymem by at least 1/4 inch. Apply the dressing over the abrasion and the adhesive part of the dressing intact with the skin. Using Polymem to reduce the pain of rib problems such as rib fractures or costochondritis is particularly effective. After locating the involved area, the most painful spot, cleaning the skin, simply apply a dressing directly over the most painful spot. And leave it in place to help reduce the pain of rib problems. I also use Polymem to control the inflammation of AC joint problems, typically a 1st or 2nd degree acromioclavicular joint sprain, or oftentimes the osteolysis that can occur as a result of weightlifting, particularly bench press. Finding the distal end of the clavicle, then sliding over to the acromion. The AC joint lies right in between. Apply dressing after cleaning the skin. Polymem is very useful in managing the pain and inflammation associated with rotator cuff tendonitis. I found the best place to start off in applying a dressing is right over the bicipital groove. So we locate the bicipital groove and apply a dressing after cleaning the skin. In addition to the anterior placed Polymem dressing for rotator cuff tendonitis, I often find it useful to put a dressing on the posterior aspect of the shoulder, directly over the glenohumeral joint. So finding the glenohumeral joint and then positioning the dressing directly over that spot. Again, to help with the pain and inflammation of rotator cuff tendonitis and other shoulder pathologies. The 3-inch sports wrap is very effective in upper extremity problems. Here, in managing elbow pain and inflammation, we use a 3-inch sports wrap with the elastic wrap attached, beginning distally from the elbow and working up, making sure that we have good contact over the entire elbow joint and then held in place by the elastic wrap. For contusions of the upper extremity, cut a piece of sports wrap to size to cover the affected area. Hold that in place for me, and then secure it to the area with an elastic wrap or self-adhesive tape in order that it has a good contact with the skin. Depending upon the size of the athlete's wrist, sometimes the sports wrap is a little too long, but it's easy to just trim it down in order to just cover the wrist joint. Sports wrap is very useful in managing wrist sprains. It's also useful in chronic conditions such as carpal tunnel and can easily be applied and then held in place with the elastic wrap. Trimming down a Polymem dressing is an effective way to manage a PIP or proximal interphalangeal joint sprain. Here we'll just trim down one edge. And then use the other edge to wrap around the finger and hold the dressing in place. Managing DIP or distal interphalangeal joint problems again can easily be assisted by trimming down a Polymem dressing and using the other end to hold the dressing in place. The finger dressing provides circumferential contact with the finger and is specifically good for PIP joints, DIP joints, or any open wounds in and along the finger since it's a sterile dressing. Measure it to size, cut it down, and then just roll it on to the finger. As you can see, Polymem products are versatile and valuable tools in your training room. Athletic trainers in professional sports and Olympic sports are using Polymem and sports wrap to help athletes get back into the game faster.